Diabetes is a condition where the blood sugars are higher than normal. This occurs for a couple reasons. It can occur when our beta cells that produce insulin in our body stop functioning or decline in function, and it can also occur when the muscles in our body become resistant to the effects of insulin and we need much more in order to control that blood glucose value. Type 1 diabetes is a condition where our body creates antibodies that turn against those beta cells and destroy them all, and you're left without any insulin at all, and you need insulin really for life in order to manage the blood sugar levels. Type 2 diabetes is a condition where the beta cell function declines over time, but additionally we have resistance at the muscle level. We might have the liver overproducing too much sugar, and all three of those things together result in high blood sugar levels. The symptoms of type 1 and type 2 diabetes are essentially the same because it's the result of those elevated blood sugar values. So most commonly what we might see is frequent urination or large amounts of urination. This results in dehydration, which makes you feel very thirsty. It can also leave you with dry skin and itchiness because of that dehydration. And you can also be losing weight without really understanding it, trying to eat more, but not being able to really catch up with that weight loss. How do you find out if you're at risk for diabetes? There really are a couple ways. You could take a paper test or one that's online to see if you have some of the associations, which include you may have had diabetes during your pregnancy, you may have a relative with diabetes, you may be from a race or ethnic group that has a high risk, such as African Americans, Latino, Asian Americans are all at higher risk of developing diabetes. But also then, if that risk comes back high, you really need to go to your doctor's office and get a blood test. And that blood test ideally should be done in the morning, or we can do an average blood test called a hemoglobin A1C, and that can also, if that comes back high, indicate that you have diabetes.